Hi, I'm Dr. Stephen Gaeta, a cardiac electrophysiologist at the Inova Heart and Vascular Institute. For the next few minutes, I'm going to discuss treatment options for restoring and maintaining normal rhythm for patients with atrial fibrillation. As you've already heard, for most of our patients with symptomatic AFib, and for some patients with asymptomatic AFib and other heart conditions like heart failure, we recommend treatment to return the heart to its normal rhythm and prevent AFib from recurring. This treatment strategy is called rhythm control. There are three common strategies to provide rhythm control for patients with AFib: cardioversions, an electrical shock, medications, or an ablation procedure. Because AFib can be a difficult long-term problem, patients oftentimes require a combination of these options at different times during their life. Starting with a cardioversion is an electrical shock to reset the heart to a normal rhythm. For this procedure, a very brief period of anesthesia is provided, and while the patient's asleep, a painless shock is delivered to the chest to reset the heart into its normal rhythm. Most people are familiar with this type of shock procedure from movies. This is a very effective way of restoring the normal rhythm of the heart, but importantly, it does not prevent future episodes of AFib. For this reason, a cardioversion alone is a good therapy for someone who has only very infrequent AFib episodes, or in combination with other treatments like medications or an ablation. There are 6 common medications used to restore and maintain normal heart rhythm. Medications work primarily by calming or slowing the electrical activity of the heart and decreasing the extra heartbeats that trigger AFib episodes. Not all medications are appropriate for all patients, and used improperly, they can actually be dangerous. The specific choice of medication is made based on the presence or the absence of other medical problems. Many times, medications are combined with a cardioversion procedure to help maintain normal rhythm after a shock has reset the heart. About half of patients do not respond to medications or can't tolerate them in their use to control AFib. Finally, ablation is a very common procedure used to treat AFib. Ablation is a minimally invasive, low-risk procedure performed through IVs placed into veins in the legs. Ablations are typically performed as a same-day in and out procedure, and patients go home a few hours after the procedure is complete. Just like with medications, the goal of an ablation procedure is to get rid of the extra sparks of electricity that trigger episodes of AFib. Ablation works by creating small areas of scar that stop these sparks of electricity from occurring or stop them from spreading into the rest of the heart. For the majority of patients, the extra sparks of electricity that trigger AFib come from within the 4 pulmonary veins that drain the blood back from the lungs into the top left chamber of the heart, the left atrium. For this reason, the goal of most AFib ablations is so-called pulmonary vein isolation, in which a small wall of scar is created that isolates these electrical signals in the pulmonary veins from the rest of the heart. Ablations performed using catheters, thin flexible tubes that are advanced to the inside surface of the heart from IVs in the legs. There's no cutting involved in this procedure. These catheters are used to make a small wall of scar tissue in a ring around those pulmonary veins. Blood can still flow through these veins after ablation, but the scar in the vein wall blocks the electrical signals from spreading into the rest of the heart and triggering AFib episodes. Ablation procedures will also occasionally target additional areas that are important sites for AFib, but this is often reserved for patients that have had AFib for a long time or have had recurrences of AFib after a first ablation procedure. Success rates for catheter ablation vary based on the type of AFib, that individual's AFib risk factors, and the type of ablation performed. Worldwide, the single procedure success rate for paroxysmal AFib is 70 to 88%, while the success rate for persistent AFib is 60 to 70%. As you've heard, AFib can be a challenging problem to solve. For a minority of patients, the strategies you've just heard about are not enough to control their AFib. For these more difficult cases, there are additional surgical options available. For some patients, a combined surgical and catheter-based procedure can be helpful. This so-called convergent procedure involves ablation procedures I've already mentioned, combined with additional ablation performed by a cardiothoracic surgeon on the outside wall of the heart. For other patients, especially those with conditions requiring heart surgery, a so-called maze procedure can be performed. In this procedure, lines of scar are created in the top chambers of the heart by a surgeon that are designed to interrupt the pathways for electricity to spread within the heart and stop the heart's ability to maintain AFib. So to summarize, there are 3 main ways of stopping AFib: cardioversions, medications, and ablation procedures. The choice between these treatment strategies depends on patient preferences, the presence or absence of other medical problems, and the stage of your AFib. But no matter how long you've had AFib or what has previously been done, there are always options that can be explored to help you feel your best. This introduction has just skimmed the surface of the treatments available for AFib. The good news is that there are better tools available now than ever before to help stop AFib and improve patients' quality of life. And at Inova, we are proud to be at the forefront of AFib care.